He's the Lib Dem MP for Winchester. He also serves as the party's mental health spokesperson. And Mr. Chambers, your debate is about the potential impact of US global health policy on the UK and international health cooperation. What are your concerns about the impact?
I've worked a lot on global health programs in different other countries around the world. And there's a lot of diseases that, for example, move from animals to humans. And COVID was the most high-profile recent one. Ebola is another one. And we have to be absolutely clear. Disease does not respect national borders. So a threat that is anywhere in the world is a threat here to the UK. So if polio still exists anywhere, it's actually our problem because we're still at risk of it. And the World Health Organization and its partners have been working for years to eradicate polio. It has almost been eradicated the same way smallpox has been gone. And if things like antibiotic resistant drugs, bacteria that our antibiotics don't work against, if they're in one part of the world, it will eventually reach our hospitals. And if there's a new pandemic emerging in another country, somewhere else in the world, it'll be on our doorstep faster than ever before. The problem with the US pulling out the World Health Organization is that it really affects all that international collaboration, all that international work that makes all our healthcare stronger. It makes us safer, and it will mean that we'll be at a greater threat to things like pandemics, antimicrobial resistance, diseases like polio that we're going to really struggle with if they pull out.
Yeah. Okay. And this is all relating to the USAID cuts, is it, or is that
Yes.
is that the reason why you want to try and debate this today?
That's exactly it. That's part of it.
It's very difficult to change his mind, though, isn't it? With all due respect to backbench MP from Winchester, how are you going to change the president's mind?
Well, you're completely right about that. But the focus of the debate will be very much what we do in the UK, how it's going to affect us, how it's going to affect our international collaborative work, how it's going to affect our research institutes, what we're going to do to make the NHS safer. So, for example, seasonal flu. Every winter, the NHS faces immense pressure from influenza, and our ability to develop the vaccines, because we know what strains to put in it, involve the US Centre for Disease Control looking at what strains they have in the US, and we all collaborate. We work out which strains the flu vaccine should contain every year. How are we going to prepare for the 2025 flu season if we are not using any American data at all? This is something that will affect us directly within months, and the UK really needs to, if we can't improve collaboration with the US on this matter, we need to work out what we're going to do about it and who else we're going to collaborate with, because it will be affecting our NHS and our people very quickly.
Danny Chambers, thank you very much indeed for the time.